Healthcare available to American citizens has been a topic of debate pretty much since America became a country. In recent years, due to the retooling of healthcare policies and the Patient Protection and Affordable Care Act, also known as the PPACA, being put into place, healthcare policies have become a lot better, but they are still not sufficient to cover the needs of America, which is why it is the proposition of myself and my partner that the federal government should provide universal healthcare to all American citizens. I'll be supporting my proposition with 3 claims. First, that all Americans should have the right to health care. Second, that the PPACA is not sufficient to cover all Americans. And third, that the benefits from a universal health care program will outweigh the problems. Let me start by defining universal health care. Universal health care is a healthcare system that provides health care and financial protection to all the citizens of its country. Remember that as I go into my first claim, all Americans should have the right to health care. Under the current system, some people do not have universal health care. This means that they can't get the universal health care, the routine care that they need, because they cannot pay for it. Anyone who needs it can get an emergency room service, whether they can pay for it or not. They're not guaranteed any care after that. America is built on the foundation that everyone has the right to life and general welfare. How can we then deny people the right to basic care and medication? In the preamble to the U.S. Constitution, it says, "We, the people of the United States, in order to form a more perfect union, among other things, promote the general welfare." That's the general welfare of the American people. Also in the introduction to the Declaration of Independence, it talks about how we hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. How can we deny people the right to basic care and medication and then still say that we want everyone to be equal and that we want them to be happy and have general welfare? Our current system is the PPACA. It's not the same thing as universal health care. The Patient Protection and Affordable Care Act is a federal health care law that is meant to reduce the number of uninsured American citizens. It uses mandates and tax credits to increase the coverage rate, but everyone's not covered. And it is not sufficient to cover everyone, which is my second point, that the PPACA is not sufficient to cover all Americans. There's still a lot of uninsured people that don't fall under the PPACA, or they choose to opt out because they can't afford the costs. Around 6 million people would rather pay the penalty tax than pay for insurance because it's still cheaper to pay the penalty. There are other problems that are caused by not having universal health care too. A lot of them are economic. For example, 62% of bankruptcies in 2010 were at least partially related to healthcare costs. So my third claim is that the benefits from a universal healthcare program will outweigh the problems. Having healthcare for everyone will decrease healthcare costs by allowing people to seek preventative care rather than waiting until they become critically ill to seek medical treatment. According to The Economist, countries that have some kind of universal healthcare coverage generally spend less. This is because the costs of a universal system are less than private. Drugs can be purchased in greater bulk. Prices for services can be negotiated at a lower rate due to the larger pool, and a large singular system will reduce the overhead involved in processing insurance and medical services. So having universal health coverage decreases costs for everyone, not just for patients. Healthcare would also be good for America's economy, since people will be healthier and their lives will be able to contribute to the economy longer. And also some people will need more healthcare than others, such as smokers will need more healthcare than people that don't smoke. But everyone pays the same rate, so no one pays more than anyone else. It is cheaper to provide preventative care rather than to pay for people that show up in the emergency room and can't pay for emergency services, which is still paid for through taxes. It's more money in everyone's pockets in the end. So I'm asking for universal health care for everyone. It can be decentralized to each state to manage its own program. Every American will be given a health services number and when they're born, and immigrants will be given a number when they become citizens. The healthcare system will be nonprofit, although hospitals and doctors will still be allowed to be for-profit. They just won't be covered under the insurance program. The way funding will work is that the public funds already funneled to Medicare and Medicaid will be retained. The rest will be made up with a 7% payroll tax on employers and a 2% income tax on citizens. In conclusion, America is one of the richest countries in the world, and yet it does not provide its citizens with health care, like so many other countries around the world do. If the federal government provided health care to all of its citizens, it would be beneficial both to Americans and to American economics. This is why I believe the federal government should provide universal health care to American citizens.
We need a place to sit. There's an empty spot back there.
Yeah, but they're up here debating right now, so.